Watching this video can save your life because a heart attack can sneak up silently, sometimes giving warning signs that are invisible and then completely changing your life. Continuing to watch can save your life. A heart attack is a sudden and serious condition. It can increase the risk of sudden death and seriously affect quality of life. Moreover, some signs of a heart attack can be mistaken for other health problems, which can delay diagnosis. Therefore, it is very important to recognize these signs and respond correctly. A heart attack usually occurs due to blockage of the coronary arteries. This blockage typically occurs due to plaque buildup and hardening of the arteries. Risk factors such as smoking, high blood pressure, high cholesterol, diabetes, obesity, and a sedentary lifestyle greatly increase the risk of a heart attack. A heart attack, also known as a myocardial infarction, can be defined as tissue death due to decreased or completely blocked blood flow, along with oxygen, to the heart muscle as a result of blockage in the coronary arteries. During a heart attack, symptoms such as chest pain or a feeling of tightness, especially for a few minutes, are due to the heart muscle being deprived of oxygen. A decrease in oxygen supply to the heart muscle can cause damage and death to the heart muscle. Reduced blood flow not only affects the heart but can also stop blood flow to other parts of the body, leading to fatal consequences. Detecting early signs of a heart attack and seeking medical help without delay can save a person's life. Major signs of a heart attack. A heart attack usually occurs during rest, rarely during exercise or sleep. Like any illness, heart attack symptoms can vary from person to person. However, typical heart attack symptoms can include chest pain. This is usually the first symptom of a heart attack. It can manifest as pressure, burning, or squeezing. In some cases, it can radiate to the back, shoulders, jaw, teeth, and left arm. It is a symptom more common in men than in women. Skin cold, pale, and moist skin. Changes in skin color may be observed. Skin coldness may be due to the shock condition the patient is experiencing. Neurological symptoms: irritability, restlessness, anxiety, cold sweats, being uncomfortable with small stimuli, and excessive reactions can be observed. Nausea and vomiting. Nausea and vomiting symptoms are more common in female patients than in male patients. Additionally, symptoms such as cold sweats and fear of death may accompany. Hiccup. Irritation in the diaphragm can cause symptoms similar to hiccups. Pulmonary changes. If heart failure develops during myocardial infarction, pulmonary problems similar to pulmonary edema may be observed. Urinary changes. Due to low blood pressure, frequent urination may be observed in the patient. Cardiovascular changes. Irregular and low pulse may be observed. Blood pressure can initially be high with the onset of pain, followed by low levels. Muscle and skeletal problems. The individual may appear tired, weak, and tense. How long do heart attack symptoms last is also a frequently asked question. However, it is not possible to give a definite answer to this question. Like symptoms, the duration of symptom occurrence also varies from person to person. However, it can be said that a heart attack is usually an acutely developing condition, and its symptoms appear suddenly. Every individual in society should be very familiar with the symptoms of a heart attack. Early diagnosis and treatment of a heart attack save lives, reduce damage, and prevent a decrease in quality of life after the disease process. What are the risk factors for a heart attack? A heart attack can occur for many reasons. These reasons are considered risk factors. Identifying these risk factors and making lifestyle changes to address them will reduce the likelihood of a heart attack and support overall health. Risk factors for a heart attack are classified as controllable risk factors and uncontrollable risk factors. Controllable risk factors are further divided into major and minor risk factors. Controllable risk factors. Major risk factors: high blood pressure, hypertension, high blood cholesterol, hyperlipidemia, and smoking or exposure to cigarette smoke. Minor risk factors: sedentary lifestyle, diabetes mellitus, excessive alcohol consumption, unhealthy eating habits rich in saturated fat, cholesterol, and calories, stress, and personality traits. Uncontrollable risk factors: male gender and postmenopausal period in females, genetic predisposition and family history. Age 55 for females and is greater than or equal to 45 for males. Presence of heart disease in the individual. What can be done to prevent a heart attack? 1. Avoid smoking. 2. Engage in regular, especially heart disease, appropriate exercises. Individuals over the age of 50 who lead a sedentary lifestyle should consult a doctor before starting an exercise program. 3. Regularly visit the doctor for blood pressure and cholesterol monitoring. 4. Maintain weight control. 5. Follow a diet low in fat, cholesterol, and salt. Healthy fat options such as nuts, avocado, olives, and olive oil should be preferred. 6. Consume plenty of vegetables, fruits, and whole grains. 7. Limit salt intake to only 5 to 6 grams per day, which can lead to high blood pressure. 8. Consume various healthy protein sources such as seafood, fish, legumes such as beans and lentils, and nuts. Red meat consumption should be limited to lean meat, and red meat consumption should be limited to 1 to 3 times a week. 9. Monitor diabetes and regularly check blood sugar levels. 10. Avoid stress. 11. Avoid alcohol or limit its consumption. You can write your thoughts and any additional comments about the video in the comments. See you in the next video.